Mr. President.
Senator from Vermont.
Thank you, Mr. President. Mr. President, today's Congressional Budget Office analysis of the Trump-McConnell health care bill gives us 22 million reasons why this legislation should not see the light of day. What CBO tells us, in truth, is that this bill really has nothing to do with health care. Rather, it is an enormous transfer of wealth from the sick, the elderly, the children, the disabled, and the poor into the pockets of the wealthiest people in this country. Mr. President, according to CBO, and that report just came out a few hours ago, this bill would throw 22 million Americans off of health insurance, cut Medicaid by over $770 billion, defund Planned Parenthood, and substantially increase premiums for older Americans. Under this bill, a 64-year-old with an income of $56,000 could see his or her premiums increase from $4,400 under current law to $16,000, an increase of nearly 850%. Now, how are older workers in this country going to deal with an 850% increase in their premiums? Meanwhile, the Trump-McConnell bill would provide a $231 billion tax break to the top 2% and hundreds of billions more in tax breaks to the big drug companies and insurance companies that are ripping off the American people every day. Mr. President, at a time when the middle class of this country continues to shrink and when families all across America are struggling to make ends meet, to put food on the table, to pay their rent, to save a few bucks for retirement, we cannot take from working-class families, we cannot take from the sick and the elderly and the children in order to give even more to the very wealthiest people in this country, people who are, at this moment, doing phenomenally well. Mr. President, this, in fact, is a barbaric and immoral piece of legislation. But let's be very clear. This is not just Bernie Sanders who opposes this bill. This is not just every member in the Democratic caucus that oppose this bill. This is not just that the overwhelming majority of the American people oppose this legislation. According to a recent NBC Wall Street Journal, only 16% of the American people thought that this bill was a good idea. This bill is opposed by virtually every major healthcare organization in this country. The people who are on the front lines, the people who today and yesterday and tomorrow are dealing with healthcare issues, dealing with the sick, working in hospitals, working in community health centers. And almost without exception, every major healthcare organization in this country opposes this bill. And maybe my Republican friends might want to ask themselves that get beyond the politics of this, get beyond Republicans and Democrats, ask the people who really know about healthcare in America, and ask yourself, how does it happen that virtually every major healthcare organization in this country opposes this legislation? This is the AARP that opposes this legislation, the largest senior group in America, who knows what high premiums for health care will do to their membership. This is the American Hospital Association. They know a little bit about hospitals and what will happen to rural hospitals if this legislation is passed. This is the American Medical Association. The American Medical Association is a conservative organization. This is the doctors' organization all over this country. This is not any progressive radical group. These are our doctors, the doctors we go to. They oppose this legislation because they know what happens if there are massive cuts to Medicaid, if 22 million people are thrown off of health insurance. It is the American Academy of Family Physicians, the American Academy of Pediatrics, who knows what this legislation will mean to the children of our country, the American Psychiatric Association, the Federation of American Hospitals, the Catholic Health Association, the American Lung Association, the Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, the American Nurses Association. Mr. President, every one of these organizations opposes the Republican legislation. Not Bernie Sanders, but every major health care organization says do not go forward with this disastrous bill. This is what the AARP, the largest senior group in America, said recently. Quote, "This new Senate bill was crafted in secrecy behind closed doors without a single hearing or open debate, and it shows. The Senate bill would hit millions of Americans with higher costs and result in less coverage for them. AARP is adamantly opposed to the age tax, which would allow insurance companies to charge older Americans 5 times more for coverage than everyone else, while reducing tax credits that help make insurance more affordable." Mr. President, I ask all of my Republican friends to think for a moment about the implications of this bill and what it means to your constituents when they lose the health care they currently have. Put yourself in their place. Today you have health insurance, but tomorrow, next year, you might not. What does that mean? Think about it. What does it mean if you are an individual today, and sadly there are too many of them, if you are a person today suffering with cancer, you are fighting for your life, maybe you're under radiation treatment, maybe you're under chemotherapy, you're scared to death, you don't have a lot of money, you have cancer, you're struggling. And now you're reading in the papers that this Republican bill may take away your health insurance from you. How do you think you feel? I suspect scared to death. And it's the same with people who have heart disease, who have asthma, who have diabetes, or any other life-threatening illness. What happens to those people, millions of those people, when they cannot afford to go to the doctor when they are sick, cannot afford to buy the medicine they desperately need? And Mr. President, and I know this is a sensitive issue, but I'm going to raise it, and that is that the horrible and unspeakable truth is that if this legislation were to pass, and I'm going to do everything I can to see that it doesn't, but if it were to pass, many thousands of our fellow Americans every single year will die, and many more will suffer and become much sicker than they should. That is not, again, Bernie Sanders talking. That is exactly what a number of studies have shown. Study after study, including one from the American Journal of Public Health, to the New England Journal of Medicine, to the Harvard School of Public Health, have told us. Again, this is not Bernie Sanders engaging in a rhetorical debate. This is what scientists and doctors who have studied the issue are telling us. In fact, Mr. President, just this afternoon, a few hours ago, the Annals of Internal Medicine, this is a prestigious medical journal, published an article from researchers at the City University of New York School of Urban Public Health at Hunter College and Harvard Medical School entitled, and I quote, "The Relationship of Health Insurance and Mortality. Is Lack of Insurance Deadly?" End of quote. That was the title of the article appearing today. According to a summary of this article, and I quote, "Insurance decreases the odds of dying among adults by at least 3% and as much as 29%, and, quote, being uninsured substantially raises the risk of dying." The co-author of this article, Dr. David Himmelstein, commented, and I quote, "According to the CBO, the Senate Republicans' plan would strip coverage from 22 million Americans. The best estimate based on scientific studies is that about 29,000 Americans would die each year as a result, end of quote. Mr. President, I know that no Republican wants to see anybody die. None of us do. But that is the reality that we are dealing with, and you cannot ignore it. If somebody has cancer, if somebody has heart disease, and you take away their health insurance, I don't need studies from Harvard University to tell me and to tell you what you know to be the case. This is the United States of America, and we can do better than that. Mr. President, I would ask unanimous consent that the article that appeared today in the Annals of Internal Medicine be submitted to the record.
Without objection.
Thank you, Mr. President. Mr. President, this issue is really not just about health care. This is a profound moral debate defining who we are as a people today and who we want to be as a people in the future. Mr. President, a great nation is not simply one judged by how many millionaires and billionaires we have and by how many tax breaks we can give to billionaires. A great nation is judged by how we treat the weakest and the most vulnerable amongst us. Those people who don't have fundraising dinners, those people who don't contribute hundreds of thousands of dollars into the political process. A great nation is judged by how we treat the children, the elderly, the sick, the poor, the people who have disabilities. That's what a great nation is. This legislation is not worthy of a great nation. This legislation must be defeated. I yield the floor.